I really appreciate that. Um, okay, I'm gonna wrap up the germline genetic questions. So I'm gonna combine two. So the first part is, have we discovered new genes beyond BRCA1 and BRCA2 that kind of everybody in the space is familiar with?
Mm,
Um, and then if so, how often as survivors should we be being tested? So the specific question is, if I was tested 10 years ago, is there benefit for me asking for the test to be repeated?
yeah, that is a really great question. And I'll tell you why. There are some patients who get diagnosed and like their family history is off the charts, or, they're really young, something that you really have a high suspicion that you're going to find something genetic or germline, as it were, and there's nothing. And it's like, there's got to be something, right? The point is that new genes are identified all the time. And so when I started fellowship almost 20 years ago, it was BRCA1 and 2, right? To your point, now when we're talking about genetic testing for hereditary cancer and breast cancer, it's a lot more than BRCA1 and 2 now, right? So it's BRCA1, BRCA2, CDH, P10. There's one called STK 11 and PALB2. So these were all genes that we weren't testing for even when I started fellowship. And so I think about, or not, not commonly, right? And I think about that a lot, like patients who we haven't identified, like when do you go back and test? So I think as you, it's always good to just kind of check in as a survivor. Hey, has there been enough in terms of new genes identified from when I was tested that I should consider testing again? And also, as your family history changes, right? So sometimes um, you're going along and then somebody else in your family gets a diagnosis, right? Your family history is now changed. And so
Mm,
whenever there's like a change in your family history, I think is another good touch point to bring up with your oncologist.
okay. Yes. Um, I was one of those. So just if anybody kind of falls into that strong family history, but no identified germline mutation. So I come from a long history of premenopausal under 50 breast cancer, and no germline mutations in any of us being tested. But there is a study going on at Fred Hutch Seattle Cancer Care Alliance. So in patients like me, if there's anybody else out there, you can donate. It's just a blood sample, and they have a bank of that, that they're doing research on to hopefully maybe identify new ones in the
Yeah.
future.
So
So we can
again,
develop drugs.
there's that question again of like clinical trials or research, or,
Exactly,
can
exactly.
you participate? And I think it only opens your
Only open.
avenues and your opportunities.